Are we ever going to get to lipid goals? That was the title of a session here at ESC 16 in Rome. We have some new data to answer that question, and it is based on the French DYSIS and DYSIS II studies. And to talk about it, I am with the PI of this particular study. It is Anselm Gitt, who is an MD and the lead author of DYSIS. So we've got DYSIS and DYSIS II. First, some background. Remind us about DYSIS.
Yeah, DYSIS stands for Dyslipidemia International Study, and it was started in the year 2008, trying to collect data on lipid goal achievement all through Europe and Canada. And later on, it was even expanded to the rest of the world. So we got data from the Middle East and from Asia Pacific. So we started with DYSIS, which was called DYSIS in the beginning. Now we say DYSIS I, because we didn't know at this time that DYSIS II was following.
It's going to be a sequel.
And the DYSIS II study, we did enroll patients in 2013 and 14. So we are currently overlooking a database of around 70,000 patients in clinical practice being treated with lipid-lowering agents for secondary prevention, and we could see how they were treated and if they have reached their goal, which are recommended. The goals are recommended by the guidelines.
Well, I really enjoyed the title of the session this morning. You know, are we ever going to get to lipid goals? It is very frustrating. So tell me, have you had any success?
Yeah, we did have some success already. So first of all, the message was coming from DYSIS that about only 20% of the patients on treatment were reaching the goal. So in other words, 80% were not reaching the goal as recommended by the guidelines.
Right.
So we had to deal with the reasons. Why is this the case? And probably analyze the data and then give feedback to the centers, and probably might take some messages for improvement. In DYSIS II, and this was presented by the French part, and which is already published last week in a peer-reviewed journal, and I just a minute ago showed some data in one of the sessions here of the overall setting. So we compared DYSIS II with DYSIS I, which by definition was done in the same way. So we had a comparison between 2008 and 9 and 2013 and 14. And what we were able to show is that in the latest data acquisition, patients were more likely to be treated with more potent statins like atorva or rosuvastatin, which is one first good step. And they have also used higher dosages of a statin, but anyhow, still very low dosages, but
right.
This was improved. And we did bring up the amount of patients at goal from 20 or 21% to 29%, so which is a substantial increase. Of course, you might say, well, it's only 8%. If you look at in a relative perspective, it's nearly a 50% relative increase of patients at goal as compared to DYSIS I. But still, there are 70% not at goal, even today.
So what's the key? What do you think is it that drove those numbers up?
Yeah, as I said, it drove up that we recognized that we are doing bad. And so the message was we have to use higher potent statins and higher dosages because this is the first line recommendation of the guidelines. And we had some success, but still, you know, there is a big gap between what the recommendation is and what we can achieve.
Do you think more people are paying attention as well as simply trying to add on more statin?
Yeah, I think, you know, a couple of years ago, the only question was, is a patient on a statin, yes, no? If yes, you know, we were done and everybody was happy. Nowadays, as we know that the level of LDL matters, we should do the second step. So having patients on statin, and this we succeeded because, you know, right. In the last 20 years, you know, the number of patients on a statin went up from nearly 0 up to 80 or 90%. But now we have to do the second step and say, well, it's not enough just to treat the patient, but we probably have to titrate the treatment to the goal.
So it needs to be an ongoing conversation to remind the patient and to make sure that the prescriptions are being filled.
Yeah, first, and you made the important point. You talk about the patient, and this is what I also like, because as a second approach, we are not only blaming the doctors, we also have to include the patient in this responsibility. And I always talk to my patients and tell them they should ask their physicians if they draw some blood samples and they do not reach the 70, they should go ahead and ask them, I'm not at 70, what shall we do? So the more taking in the patient as a responsible person also for himself, because it's his risk which should be reduced.
I mean, for a while now, the ACC has been emphasizing this conversation that needs to take place between doctor and patient.
The problem is this is very time consuming, and we have little time to do this, but we should, change our practice and spend this time because it's worthwhile.
Yeah, the data suggests it's worth the effort.
Yeah, that's it.
So what were you presenting here? What can you tell us about your presentation at ESC?
No, the DYSIS data, I showed different parts of analysis in DYSIS. First of all, I showed we have in DYSIS II not only patients with chronic stable and coronary artery disease, but also ACS. And we did see that in the ACS population still also the amount of patients is very low, who do reach the target. We looked at data even of follow-up of the ACS patients. We had a 4-month follow-up in DYSIS II ACS, where we looked at the changes in treatment as compared to the discharge treatment, and there was no change. So in other words, we are currently thinking that physicians who are responsible for the ongoing treatment might react, but they don't do. So currently there is another point of discussion opening to say, well, shall we rely on, let's say, the healthcare system that physicians who are treating outpatients should do or finish the job? I'm currently more in the mood to say we in hospital, if we have a patient with ACS, we should finish the job and put the statin on the highest tolerable dose of lipid lowering, and probably we might make a difference with this.
Do you have any optimism that you'll be able to get those numbers up again in about 5, 6, 7 years?
Yes, I'm optimistic, but the real data will tell us. But there's such a big space for improvement, and we do have now options for better treatment with combination treatment and new compounds, that this will facilitate to reach our goals.
Well, thank you. I appreciate your time considerably, and congratulations. It's nice to see some good news in lipid lowering. And
thank you.
For our ESC coverage, please check out CardioSource World News and CardioSource World News Interventions, where I'm Executive Editor Rick McGuire.